Hi, I'm Dr. Castanet in Decatur, Georgia. I had a patient today that reminds me of a topic that I don't know that I've discussed before, but it's a fairly frequent conversation I have with patients. I would say that for spine specialists who see patients, there are probably 10 or 15% of patients that we don't know what exactly is the source of the pain. We'll do x-rays or MRI scan. We'll see what looks like what we term age-appropriate amount of wear and tear or degeneration in the neck and the back. And nothing particularly stands out and says, this is the source of the pain. This is why the person is hurting. In that circumstance, of course, there's no harm in doing conservative treatments that are not invasive and experimenting and seeing if you can find something that will help a patient. I'll do that, but I'll frame it for the patient so that they understand that I'm not certain what the source of the pain is. I'll point out whatever lesions I may or may not, that I may see on x-rays or MRI scan, not necessarily imputing that lesion, that visible lesion, to the source of their pain. Sometimes, again, like I said, you'll have average amount of degeneration in the neck or back for somebody that's at any given age, and you'll say, well, you have this little bit in your neck or back. I'm not certain that is the source of your pain, but we'll treat you and we'll see how you respond. And most of the time, patients are going to get better even when you don't know what the source of the pain is, because at least the implication there is that they don't have a serious lesion in the neck or back that we can see, and that's serious and unlikely to respond favorably with conservative treatment. So most of those patients, even when we don't know exactly why they're hurting, are going to get better from whatever conservative treatment we will try. So I just want to make that apparent. There are other practitioners, especially those that don't have a lot of experience, I think, and that are new, and that maybe not comfortable not knowing everything, and they sort of pretend to know more than they do. And I would say that this is more likely to happen from chiropractors and physical therapists who have a number of hypotheses about why people hurt in a variety of ways. These are unproven oftentimes, and they're not comfortable saying, I don't know. And they want to provide some information. In fact, when I don't know, at least I'll inform the patient as much as I do know, and they're generally comfortable with me saying I don't know if in fact that's the case. The person that said I don't know more in my presence than anyone else was the neurosurgeon. The guy that knew the most said he didn't know more often than other people. I've also worked with orthopedists and physical medicine doctors, so some of this is personal to each doctor, and some of it's a function of, when you're comfortable in your knowledge, you don't pretend to know more than you know, and you're comfortable saying, I don't know, when you don't. And there's a lot of value in that also. When you don't know, if you don't find a solution fast for a patient, then you need to refer them elsewhere, and don't be confident in treating them for something you're uncertain of, nor do you want them to feel confident that you know what you're doing if in fact you don't know what the source of the pain is. You don't want to waste time, you don't want to waste money, and you want them to move on to somebody that maybe can help them. And there are occasions when we just don't know why people are hurting, or we don't know why they're hurting as much as they are. There are millions and millions and millions of people in chronic pain clinics, and we don't always know why they're hurting, why they don't respond to treatment, why they do when they do. It's a bit of a black box, and that is unfortunately the reality in 2022 in medicine. Anyway, if I can help you with your neck or back pain, and I can most of the time, I'm in Decatur, Georgia. My name is Dr. Castanet. The number is 404-558-4015, and the website is backstrong.net. You can also click from that website to my YouTube channel if you'd like to see more videos on a variety of topics related to neck and back pain. Thanks a lot. Bye-bye.